So first we have Joe McCannon, who works at the U.S. Department of Health and Human Services as a senior advisor, Agency for Healthcare Research and Quality. Joe contributes to the standing up the department's new Office of Climate Change and Health Equity. He manages the office's work to mobilize and support the healthcare sector. He served in the Obama administration as senior advisor to the administrator at the Centers for Medicare and Medicaid Services, CMS. And he was also a part of the founding team at the Center for Medicare and Medicaid Innovation. He was previously vice president at the Institute for Healthcare Improvement and co-founder of the Billions Institute. He has taught graduate level courses on large-scale change and quality improvement at the UPenn School of Social Policy and Practice and the Harvard T.H. Chan School of Public Health. And his writings have appeared in JAMA, the New England Journal of Medicine, Health Affairs, and Harvard Business Review. He is a graduate of Harvard University and was a Reuters Fellow at Stanford University. We also have, and I'm sorry if I mispronounce your last name, but Jenny Kerouac, and she is a senior policy advisor with the Office of Climate Change and Health Equity. Previously, she was the health insurance specialist with the Centers for Medicare and Medicaid Services Office of Legislation, a Fulbright research grantee in Romania, and senior analyst at the National Journal Network Science Initiative. And with that, I'm excited to turn it over to our two presenters for the day.
Thank you. Thanks so much for having us. I will share my screen here and let Joe get started.
Thank you, Jenny, and let me just echo your thanks to everyone that's on the line here today. We are admirers of your group and really looking forward to more about what we've been doing over the last few years to really try to catalyze action on climate health across the United States. So we think the best version of a session like this one is an exchange, and so we'll try to move at a pretty healthy clip and then open things up for discussion of some of our ideas and also some of your questions and your suggestions as well. Before we walk through the specific offerings that we have available around the Inflation Reduction Act, which really is a transformative piece of legislation that will create significant opportunities for your organizations and your members. I do just want to take a little moment to do some level setting and say a little bit more about the context that brings us here to this conversation and brings our office into being, really. And that has everything to do with, if we go to the next slide, both the catastrophic climate-related events that we're contending with in the country and around the world right now, the high-powered storms, the wildfires of the kind that we saw devastate Maui and impact the East Coast this summer, the flooding, which is happening 2 towns away from me right now, and maybe above all, in terms of mortality and morbidity, the extreme heat. It's the combination of these catastrophic events, plus, if we go to the next slide, the broader chronic impacts of climate change, the vector-borne illness, the waterborne illness, the increase in allergens, the exacerbations of cardiovascular disease and asthma, the broad set of impacts associated with climate change, both chronic, acute, and catastrophic, are just massive and devastating. And I think as a country and as a health system now, we're reeling and trying to deal with those. On top of that, we know that the actual regular operation and functioning of the health system, the ability to sort of keep our doors open and provide reliable services, is undermined as well. And that has to do with the fact that there's been a steady increase in billion-dollar disaster events, as shown here, over the last 40 years. That number seems to be increasing all of the time. And we know what that means from a healthcare standpoint is that the facilities that get impacted, that can't keep their doors open or that have disruptions in operations, are in a situation where they're having to evacuate patients or they're having to turn patients away. And this is exactly the type of catastrophe that we seek to avoid. So you have the acute climate-related events, the chronic sequelae of climate change, these threats to regular and normal operations. And then on top of that, you have the reason that we're not just the Office of Climate Change, but the Office of Climate Change and Health Equity. And that's to do with the fact that we know that, like just about every public health issue in this country, the impacts that we're looking at are disproportionately felt by certain populations in the country for reasons of decades of underinvestment and disenfranchisement and discrimination. We know that there are certain communities that are much more exposed and much more vulnerable, so that when climate-related events occur, there's going to be much more harm in those places. And we're talking here about indigenous communities, communities of color, elderly communities, rural communities, LGBTQIA communities. All of these communities are at disproportionate risk. Disabled communities, the list is long. And so we need to make sure that we're proactively thinking about the needs of those populations. So that all of that together is the constellation of reasons why we exist as an office. Now, it's not to say that work like this hasn't happened at HHS over the last several decades. It certainly has. So there is a climate and health office at the Centers for Disease Control and Prevention, which has done some important local and regional work. There is the National Institute for Environmental Health Sciences, part of the NIH, which focuses on research associated with environmental health. There is the work of the Assistant Secretary for Preparedness and Response, which is the HHS agency responsible for the medical response to catastrophic disasters, including climate-related disasters. So there's a lot that's happened, but what the Biden administration did in creating our office is it said there should be a purpose-built entity within HHS responsible for mobilizing all of HHS, this massive agency, to take action to protect the most vulnerable populations from the impacts of climate change. And so we were set up by executive order in January of 2021, formally stood up as an office in August of 2021, so just a couple of years ago now, to act as this coordinative force across the entire Department of Health and Human Services to bring together all the agencies, CMS, CDC, FDA, HRSA, SAMHSA, NIH, the list is long, but to bring them all together to say, what can we do to address the vulnerabilities that we're seeing related to climate change, and how can we take more meaningful and more substantive action. So we were set up within the Office of the Assistant Secretary for Health, Admiral Rachel Levine, who's a great leader and a great supporter of this work, and set up with a vision that's a bold one for such a small office, but you know, we're hoping to get there through work with and through others that have more leverage. We say that in the next 5 years, we hope that communities and healthcare organizations across the country are transformed such that every community and care provider in every geography is prepared for disruptive and chronic climate impacts of the kind that I was describing, such that healthcare facilities can avoid the disruptions in service that I was describing, and such that hospitals and health systems are actively and proactively taking responsibility for their own contributions to climate change, which is to say the roughly 8.5–9% of emissions that the healthcare sector is responsible for when you look at overall carbon emissions in the United States. So you know, we want the full sector to be engaged on tackling Scope 1 emissions, direct on-site emissions, Scope 2 emissions, emissions associated with purchased energy, and Scope 3 emissions, emissions related to the supply chain or the value chain for healthcare. And again, our job is to make sure that all HHS operating divisions and agencies are contributing to this goal. So that's our starting point as an office, and the way we've begun our work in the last 2 years is to first just be very clear about what we're trying to accomplish, and so we've reinforced this vision with an HHS strategy AIM, which is the first of its kind at HHS. We've reinforced this by joining the United Nations climate conference, COP26,
Health program for COP26.
yeah, the Conference of Parties is the phrase that was escaping me. Joining the Conference of Parties for COP26 in 2021. We have also been reinforced by something called Executive Order 14057, which is the Biden administration's executive order requiring all federal facilities, including federal health systems, to meet the administration's goals for emissions reduction, which is a 50% reduction roughly in emissions in the next 10 years and achieving net zero by 2050. So, we work with the Veterans Health Administration, with the Defense Health Agency, with the Indian Health Service to make sure that they're all on track for that as well. So there's been a lot by way of making commitments and putting a stake in the ground in terms of what we're trying to accomplish as an administration and as a department. What we then did is we sort of opened the door for the private sector to match that, because of course the vast majority of care provision in the country comes from the private sector. And so we launched something with the White House called the White House HHS Health Sector Climate Pledge, which invites organizations to match the administration's goals for emissions reduction, to designate executive level leadership for work on resilience and sustainability, and to develop a scope 3 inventory to document sort of supply chain related emissions, and to develop and release climate resilience plans that focus on the most vulnerable populations in the community. We issued this challenge, and we were delighted, if we go to the next slide, by the degree of response that we've observed from the healthcare sector. Over 115 organizations have taken that pledge to align with the administration's goals. They represent over 850 hospitals and over 250 health centers among the organizations that have signed. And together with federal hospitals, that totals more than 15% of the hospitals in the country. In addition, a number of other healthcare stakeholders have joined: suppliers, pharmaceutical companies, insurers, group purchasing organizations. All of these together have said we are going to tackle these goals and proactively and publicly track our progress against them. So it's a good start. It sort of creates a sense of purpose. It is an acknowledgement, I think, by the industry that we have a serious challenge and action is necessary, but we know that it is also just words. It's just a pledge. It's just a set of commitments. And so the second parallel enterprise for our office over the last few years has been to develop and introduce resources and supports to actually help organizations drive change. And so we have done that initially through a webinar series, sort of documenting all of the federal resources that are broadly available, a compendium that Jenny created, which described all of the existing federal tools and supports that are in place. We were in our small little office canvassing all of the other operating divisions to document the supports that they have available, doing everything we could. And it was a great start, but then last summer, just a little over a year ago now, something really transformative happened, and that, of course, was the signing of the Inflation Reduction Act, this massive historic legislation, which will really allow us, if we take advantage of it as a healthcare sector, to transition the industry to become more sustainable and more resilient in a comprehensive way. We can really change the trajectory of the sector if we take advantage of these tax credits and grants and loans that are a part of the legislation. So we have created something called the Health Sector Resource Hub, which includes a lot of information and a lot of supports, but which is really anchored by the Inflation Reduction Act and the opportunities it creates. And Jenny is going to talk through some of those specific opportunities with you more to inform you, but also in hopes that you'll become agents and disseminators of this knowledge as well. We really know that this will only succeed from the standpoint of the healthcare sector if awareness is raised and organizations can actually navigate the mechanics of applying for these funds. And so we really want to make sure that you are pulling with us on that to the degree possible. So I'll turn it over to Jenny and then come back to you at the end.
Great, thank you. And thanks again for having us. We're really excited to speak with you today. So I'm going to share this resource that we created with our White House colleagues and colleagues across different agencies called the Quick Finder for leveraging the IRA for the health sector. And the idea here is that the IRA doesn't, list all the types of entities that are eligible for every program, for every tax credit, for every grant, right? It would be too wide, it'd be too large. And so we went through this big piece of legislation and all of the associated guidance that has come out to find what are the opportunities that are most applicable to the health sector. Not all of these will be applicable for every entity, but actually I think most of them are applicable for most entities depending on the type of project that you're envisioning. So I really encourage you to check it out and let us know if you have questions. We also do have alerts we send out when there's new opportunities opening, and so you can sign up for those on this page that I'm showing on the screen, as well as at the QR code that we'll show at the end. So I will go through these at a very high level, but we really welcome questions, and we do have a webinar series where we go through these in a lot more detail with folks from the agencies that actually run these programs. So if you have questions that I'm not answering or that I can't answer today, I really encourage you to check out those webinars. And if they're still not answered, please let us know and we'll try to figure it out with you. So to get started, there are a number of investments and actions that are potentially facilitated by the IRA, more than I can even show on the screen probably, but these are some of the big ones that we want you to be aware of. So we have more of the resilience side on the bottom of the screen, increasing building resilience, community resilience. And then on the top, we have a lot of actions that relate to generation of energy on site, sustainability improvements, energy efficiency improvements, things that can decrease your overall contribution to climate change and to greenhouse gas emissions. But one thing that I always like to note at the top is that really these are integrally related. And even if I listed a program in one, often they have externalities across all of these goals. So for example, if you have a microgrid on site where you're storing energy on site, say that you collected from a solar panel or from wind turbines, that's sustainability, right? You're not, using unclean energy, you're using clean energy instead. And that's an end unto itself. But because you've stored that energy on site, it's also more energy efficient. It's not traveling from a faraway central grid to get to you. So you've already increased your energy efficiency. And then if the central grid goes down, you are also able to stay open in that emergency for some length of time using the energy that you've stored. So it's also a huge resilience benefit. And I'll just say one thing we emphasize there as well is because you're not running a generator, say on diesel, you're also not going to pollute your community during one of those events when you have to rely on backup power. So that's to say that these things are all really integrally related. And I think while we will cite them for a certain type of investment or certain action, most programs can be applicable both to the resilience side and the sustainability side of what we're kind of recommending here. So I'll talk a bit about these programs at a high level, and I encourage you to put questions in the chat. We can go through those at the end, but also if you have questions, I'm happy to kind of take those up via email later on if they're kind of more detailed or more specific. So the first thing I'll talk about is the tax credits that are really transformative and can help a lot with investing in on-site generation of renewable energy and low emissions transportation. And the reason I talk about these two together is because they both pertain to these tax credits. And a really transformative thing about the IRA is elective pay. So this is often called direct pay as well. So elective pay / direct pay means that a tax-exempt entity or a government entity that does not owe federal income taxes can, for the very first time, collect the full value of a tax credit as a payment. So with the grant or loan, often you'll apply, you'll be eligible, but then you won't get it in some cases because it's a competitive process. This is not competitive. This is if you're eligible for elective pay, maybe you're a 501c organization or you're a municipal hospital. If you are eligible for elective pay under, one of those categories, and I will show those here. This is the full list of kind of applicable entities for elective pay as defined by Treasury in their proposed rule. So if you're eligible and you do the actual action the tax credit requires, like say putting in a microgrid, putting in a solar array, then you will receive the payment. And that's really transformative. So unlike other programs where you have to outlay this big cost of your staff time, of your time to apply for the grant, and then maybe not get it, this is not an application in that sense. And it's also something where you're guaranteed to get the payment because you did the action and you are eligible. So that already is really transformative. And I'll talk in a little more granularity about the actual tax credits themselves. So in total, there are 12 tax credits that those entities that I just mentioned are eligible to claim. And the one that I really want to highlight for you is the third one down. So one of the most relevant tax credits here for the health sector is the investment tax credit for energy property, also called ITC for investment tax credit. And this credit covers a certain percentage of an investment in renewable energy projects. And that can include solar, wind, geothermal, microgrids, all the ones kind of listed on this slide. And the great thing is you can get up to 30% of your investment back if you meet all of the apprenticeship and wage labor requirements that go with this tax credit. So that's amazing. But there's also, if you look at the third from the bottom there, the low income communities bonus credit, also commonly referred to as an adder because it adds on to other tax credits. That bonus credit or adder can add to the ITC, meaning it goes from 30% to 50% if you're in a low income community or you're serving a low income community. So this is just an amazing opportunity to put in, say, a microgrid, a solar panel array, a really transformative investment for a health entity, and get maybe half of that investment back from Treasury. So that's great. I've listed all of them here, and I'll just note the investment tax credit is for specific technologies before 2025, and then post 2025, it becomes technology neutral before eventually phasing out around 2032. So that's just kind of some logistics there. So it refers to both of the third and fourth thing here. The investment tax credit kind of transitions between big technology specific to technology neutral, but requiring like zero emissions technology to be used after that point. I'll talk a little bit about the other tax credits that are applicable here. I won't go through them in a lot of detail, and I really encourage you to look at Treasury's guidance. They have great FAQs that specify a lot of things, even things related to the health sector. So for example, the third one down here, the credit for qualified commercial clean vehicles, they actually do specify that electric ambulances qualify in the guidance, and you can see on this slide as well. So that's great news, and we really hope that that guidance is helpful to you as you think about how you may be able to use these tax credits. And so that credit for qualified commercial clean vehicles is capped at $7,500 for vehicles under 14,000 pounds and $40,000 for all other clean vehicles. And then I'll also note the one right below that for vehicle refueling properties. That's really for charging stations and the like, and it's limited to low income and non-urban areas. So it's a tax credit for up to 30% of that investment. So again, you're seeing a lot of opportunities here depending on what you want to do and your facility's needs to utilize these tax credits with elective pay. And again, I just want to emphasize, it's not a grant. The only exception to that is the low-income communities adder, where you can see the application is required. That one is limited, and there is that application for low-income communities. But for the rest, if you are eligible and you do the activity, you get the payment. And that's really transformative. So that's why I start with these opportunities. But there are a number of other great opportunities in the IRA, and I'll touch on some of them here, but feel free to let me know if you have questions in the chat as well. So now we'll talk a little bit about other ways the provider could save on energy bills, and that's energy efficiency improvements. But both the programs I have listed here really can also fund on-site generation of energy. So that's just kind of a note for you all to kind of explain that we put them into categories to get you thinking and to help you understand some broad uses, but really many of these can go across categories. So the first grant program I'll mention is the Greenhouse Gas Reduction Fund. In the press, this is referred to as the EPA's Green Bank. It's the largest non-tax investment in the IRA. It's $27 billion. So huge pot of money, and it's being implemented in alignment with Justice 40, and that means that 40% of the overall benefits flow to disadvantaged communities. So this is a really great opportunity for the health sector, and specifically, there are these three kind of pillars that GGRF is being implemented in. The first is the National Clean Investment Fund, which will fund 2 to 3 national nonprofits that will partner with private capital providers to provide financing at scale to businesses, developers, and communities. And the EPA is envisioning this catalyzing tens of thousands of projects to create clean energy. So right now, the funding opportunity for those national nonprofits is open. So they are applying. And what I would kind of encourage you to do is right now you can't apply because they haven't been chosen to distribute that funding. It's going to go from the EPA to those nonprofits and hopefully to you. But what I think you can do, and what the EPA is encouraging, is you can get a baseline of energy use for your facility. You can know what your needs are, what your use is now, and that can help you with your application later on. And this money does have to go out fairly quickly. The deadline, as you can see here, for the intermediaries, the nonprofits, is October 12th. And then EPA has to get this money fully out the door by September 2024. So they're going to work very quickly to get this money to the nonprofit so that they can go to you. And then the second stream here is very similar to the first. It's the Clean Communities Investment Accelerator. That's going to fund 2 to 7 nonprofits that will sprinkle out the funding to community lenders. So they're envisioning hundreds of community lenders all across the country that will fund decarbonization through these projects, through this funding, much smaller funding than the first stream, but a lot more grants given because it's these smaller grants. And those lenders could be smaller green banks, CDFIs, native CDFIs, all kinds of entities. So again, I would say right now is the time to kind of think about what you might do with this funding and build your case and wait for the actual recipients of those intermediate grants to be announced. The last stream here is Solar for All, and that's residential, so I won't really talk about it much. We're excited about it, but it's not so much for the health sector, so I won't emphasize it here today. I'm going to transition here to talking about the Rural Energy for America program, also called REAP. If you are a rural entity, and rural is defined quite broadly to mean a community of under 50,000 people, you might be eligible for this program. And actually, REAP has released some information on nonprofits that have used it so far, and I'll note that. But it's really, for-profits, for-profit small businesses in these communities of under 50,000 people who have utilized the program. And it's really exciting because REAP has this huge pot of money they've been given by the IRA, and they're trying to get all of it out the door before September 2024. So they have these grant applications open, they're coming open on a rolling basis. They'll kind of be open until September of next year. And it's just an amazing opportunity for rural providers. So the first type of eligible program are these clean energy programs like solar, wind, biomass. And so many health facilities have actually already utilized REAP, and that includes the Centro de Diagnóstico y Tratamiento San Sebastián, which is a health service clinic in Puerto Rico. The investment will be used to purchase a 96 kilowatt photovoltaic solar system connected to a battery backup storage system that will ensure that the facility never loses power. And it will realize $42,000 a year in savings and replace 142,000 kilowatt hours of energy per year, which is enough to power 13 homes. So that's just one example to kind of get you thinking. We have that example listed in the Quick Finder, that document I had at the very beginning. So if you want more examples, I would look there, but I wanted to kind of provide that as an illustration of what REAP can do and has done very recently for the health sector. The other kind of side of REAP are energy efficiency projects like lighting, heating, and cooling. And an example from that is that Oaks Healthcare is using a REAP grant to purchase and install a 350-ton chiller system for a nursing home and long-term care campus of buildings. It will save 560 kilowatt hours per year, which is enough electricity to power 52 homes. So again, just seeing this incredibly impactful program. This is for rural entities, so I know it's not for everybody, but because it is so impactful, I always want to note it because the money is going out quickly, and I really want your facilities to be able to take advantage of this if you are in those rural areas. I'll be a little bit more brief with the next programs, which are more focused on resilience. After this terrible summer that we've had with so many climate hazards, we want to make sure that the health sector is able to utilize these programs not only to decarbonize, but to become more resilient. And so one of the big ways that we hope you'll be able to do that is the Staff Act assistance. So this is kind of an interesting one where it's not funding. What the IRA has done is said that FEMA may be able to provide financial assistance for these 3 programs that you see. These are the Stafford Act programs for costs associated with low carbon materials and incentives that encourage low carbon and net zero energy projects. So FEMA didn't receive any new funding or incentives, but instead it's changing what FEMA can do within the current framework of Stafford Act programs and assistance. And this sunsets in 2026. So it's time-limited authority for FEMA to do different things than they usually would with their Stafford Act programs. I have some summaries of those programs here. In the interest of time, I won't go through them in a lot of detail, but essentially what they aim to do is prepare communities and facilities for extreme weather events and then help them recover from those events after they've happened. So especially, I think if you're in a facility that is rebuilding with one of these grants or applying for one of these grants, it's a great opportunity to use low carbon materials. And those preferred materials actually have been defined. FEMA was the very first agency to put out its IRA guidance after the IRA came out. So that we're very happy for them. That's great. It came out in March. So they're a very early adopter here. And what they did is they worked with the Environmental Protection Agency and other parts of the government to create this guidance. And it gives you the parameters around the low carbon materials that can be used for those 3 programs I showed on the previous screen. And so low carbon materials are construction materials and products that have substantially lower levels of embodied greenhouse gas emissions. And that's across all of the phases of production. So it's a pretty in-depth piece of guidance and a great way to kind of learn about what FEMA is recommending. It can include concrete, glass, steel that they've given certain specifications for around the global warming potential of those products. So at this point, the last category of investments that I want to talk about is increased community resilience. And there are a lot of programs that can do this. You'll see in the Quick Finder, it's actually the longest section of the Quick Finder because there's a lot of programs. Some are specific to tribal entities, Native Hawaiian entities, other types of very specific groups. I'll talk about one broad one here, but I encourage you to kind of look at that section if you think you kind of are interested in doing some of these grants, which are particularly focused around environmental and climate justice. So the program that I'll mention here is the Environmental and Climate Justice Program from the EPA. And they have actually 4 streams to this program. I won't define all of them because they're very technical, but the Community Change Grants Program is the one that I wanted to mention for you. And the EPA expects to award between $10 and $20 million for multifaceted projects addressing a range of pollution, climate change, and other priority issues. And they're also going to give some smaller grants for facilitating community engagement in government processes. Right now, EPA is still defining eligibility, but the Notice of Funding Opportunity, also called NOFO, is expected to come out very soon in early autumn of 2023. So I'd keep an eye out for that NOFO. And right now, what EPA is saying is that eligibility will be for a partnership of at least 2 community-based nonprofit organizations, or a partnership of one or more of those organizations with a federally recognized tribe, a local government, or an institution of higher learning. And right now, the parameters around the nonprofits are what you see here from this regulation. It's very broad, basically. It's like a nonprofit entity can be eligible. So if you're at an academic institution or just a nonprofit provider, I think this is a really cool opportunity because the funding can be for a huge array of EJ issues. It can be for addressing urban heat islands. It can be for creating more resilient infrastructure. So there's a really, really broad array of things you could apply for. And with the NOFO coming soon, I'd like to kind of encourage you to think about creative uses of this program and how you can get ready to have a really great grant application in partnership with one or more other organizations. I know I said a lot, and I apologize for how dense this is. I'm just trying to kind of transmit to you the highlights. But we go through this in a lot more detail with each of the agencies that I mentioned who run these programs like EPA, FEMA, Treasury, and others in this webinar series. And so you can go watch these at the QR code here. We may have more this year if needed, so we'll keep you updated on that through our OCCHE alerts, which I'll share in a moment. But before I do that, I'll turn you back over to Joe to kind of wrap up, and then we're really excited to take questions and have a discussion with you all.
Thanks, Jenny. And yeah, I think I just want to wrap up by making a few points that I think are responsive to a question that came up in the chat regarding what can be done for individuals who are in organizations that maybe haven't signed on to the White House HHS pledge or are maybe earlier in their stage when it comes to this work. And the first thing I would say is actually something that's been said in the chat, which is, there's no requirement to sign the pledge to in order to take advantage of IRA funds. So these funds are available. The pledge is not a prerequisite. We think the pledge is helpful and motivating, but we also know that some organizations might want to invest in some capital improvements before they feel confident enough to take the pledge. So that's fine too. You could do the IRA and then sign the pledge, or take advantage of IRA provisions and then sign the pledge. But beyond that, I think what I want to say is that we really know and believe that individuals in organizations that are kind of contemplating their next steps when it comes to resilience and sustainability can have enormous influence. And a collection of 10 to 20 nurse leaders and other clinicians that are very clear on what they're trying to accomplish, and very clear on not just sort of telling the organization what it's doing wrong, but introducing opportunities like these for making significant investments, that can make an enormous difference and really drive a lot of change. And so our request or our hope is that you all are able to act as that set of catalysts within your own organizations, raising awareness about what's possible here. I think maybe particularly underlining the cost savings that are associated with a lot of these actions for those in the organization that might need to be persuaded of that at a time when sometimes operating margins are tight, or organizations are under financial constraints. So making the case, I think, is something that can be done in really compelling ways. And I think if you review our resources like the IRA Quick Finder that Jenny mentioned, you'll find case examples there, and there's an increasingly growing number of examples like that you can tap into. We also think that you can be really impactful by just creating venues to educate your peers and to educate other organizations in your area about these possibilities. So if you're working on a local or regional level, we're certainly happy to speak with groups in your area. State hospital associations, state nursing associations, medical societies, these are all venues that can be meaningful, in addition, of course, to your own group. And, we are also always on the lookout for case examples, for concrete examples where investments of the kind made possible by the IRA really are leading to energy savings or building efficiencies or cost savings that we can share with the rest of the country. So there's lots that can be done. And I think that, thinking about this almost with an organizing mindset, how will you organize a critical mass of staff and clinicians and leadership in your organizations to reach a point where this starts to make sense is really a critically important project. And I think, the knock-on effect is that if you're able to have success at your facility or at your site, others start to observe that, so really we know that if one organization in a metropolitan area introduces a solar grid and that leads to a lot of savings and a lot of efficiency and improved resilience, that's going to influence others. So I think there's a lot that you can do there. And we just want to be your partners in being those agents of change in your communities. So I think we'll stop there, open up the floor to any questions you have, and really eager to hear your ideas and your inquiries.
Thank you, Joe and Jenny. My name is Sue Ellen Brakey. I'm the co-chair of the Global Climate Change Committee, along with Daniel, who introduced you all. So I want to thank you for a really excellent overview. There's a lot to digest and take in, but as you were speaking, I was on the Quick Finder, and that looks like an excellent resource. We have some questions in the chat, but before we begin, I just wanted to, just get your perspective about, we've had quite a summer. I'm in the Northeast. We've had, impacts from wildfire smoke. Just last week, we had, school openings on the hottest day of the year. We've had an area in Massachusetts that just had severe flooding, received 8 inches of rain overnight. And it's gotten me thinking a lot about individual resilience and emergency preparedness, and then really thinking about this environmental justice perspective about people who may not have the means or the awareness to understand what an emergency kit might look like. And so I, as a nurse who teaches in a community that has some disadvantaged folks. I've been thinking a lot about that. I'm wondering if you can speak to that at all, if there's any conversations about that, the need for really to increase individual resilience, and how can we get people to know what resources are available to them?
Yeah, so I mean, I'll say that, you know, when we think of our mission as an office, it's really, to oversimplify it, it's twofold. It's decarbonization, you know, so how do we help the sector reduce its emissions? And some of that has to do with building operations, some of it has to do with the delivery of clinical care, some of it has to do with the supply chain, all the things we've discussed. But the other major area is resilience. And when we think about resilience, you know, resilience operates at several levels. It absolutely operates at the individual level, and it has to do with challenges to physical health, but mental health and well-being as well. And so we know that, you know, there are serious impacts in communities that are particularly exposed and vulnerable. There are generational impacts. We know younger people are dealing with high levels of anxiety and depression. So all of that is a part of this enterprise. There's also resilience at the community level. So what does the community have in place in terms of its infrastructure and its systems to be able to respond and to react to crises that are in place? And then there's facility-based resilience. So can these linchpin organizations, the hospitals, the health centers, the nursing homes, actually be resilient and respond? Unfortunately, I think the situation we're in as a country right now is that the readiness and preparedness and resilience is highly variable around the country. There was a study that came out at this time last year, which showed that in the major coastal cities, I think, you know, something like, and don't quote me on this exact number, but, you know, something like a quarter to a third of those cities wouldn't be in their hospitals wouldn't be ready to prepare manage a Category 2 storm. You know, there's a report that just came out from the Office of the Inspector General, which showed that something like 70+% of nursing homes are not ready for the battery of different emergencies that they're dealing with. So the healthcare infrastructure is really not resilient either. So I think that, you know, what we need to do is we need to make sure that we're introducing resources and supports on all of those different levels. And I think the Inflation Reduction Act makes a lot of that possible in the ways that Jenny described, but our office has also introduced supports along those lines, including something called the Climate and Health Outlook, which is a forecast that health systems can use to anticipate climate-related threats and climate-related challenges. We have a resilience framework that's been developed for healthcare facilities to help them understand at the facility level the actions that can be taken to develop effective climate resilience plans. We have a referral guide for frontline clinicians, which describes to them the federal resources that are available that they can point to help patients and families with a variety of different climate-related challenges they're experiencing, whether it's the LIHEAP program to help with home cooling in the summertime or heating in the wintertime, whether it's Medicare and Medicaid flexibilities, specifically associated with preparing for heat burdens and other climate-related burdens. There's a whole set of ideas and resources that are available in that guide. So there's a lot that's there. Jenny has dropped those pieces into the chat. But I think you're right. You know, we've really got to be thinking along those lines. And you know, yeah, I'm aware of what's happening in Leominster. In fact, I got, you know, a series of texts from friends in that area yesterday showing me pictures of whole neighborhoods being flooded. And it's striking to me that, you know, in you know, maybe 10 or 15 years ago that would have been front page news, and now there's just such a steady stream of events, including the devastating flooding in Libya, of course the aftermath of the earthquake in Morocco. There are all of these things happening across the country, you know, persistent extreme heat in the south, all of these things happening at such a level of frequency and intensity that I think it is both psychologically and physically a lot to bear and a lot to process. And so we're also working with the Substance Abuse and Mental Health Services Administration, SAMHSA, which has been bolstering its own work in this area, both for sort of pre-event and post-event disaster management.
Great. Thank you so much for that. So this is a repost of a question that was sent to Daniel, my co-chair. I'm mostly working on waste reduction, currently diverting 50 pounds of plastic, pharmacy bags from the waste stream and recycling number 2 plastics. Are there tax credits for initiatives under scope 3?
It's a good question. I'm not aware of anything under the IRA that would be specifically for scope 3. There are a lot of state and local incentives I know in certain states, and I imagine that's kind of not what this question was, but under the IRA, nothing is coming to mind, but I'll let you know if we learn of something.
Yeah.
Okay, great.
I guess I would just add that, one way to think of scope 3 is that, scope 3 for one organization is another organization's scope 1 and 2. So hopefully in some cases, the work on scope 3 in some organizations, the work on scope 1 and 2 in some organizations will have impact on your scope 3 emissions. But I realize what you're talking about here is a direct on-site project related to scope 3 around waste reduction. And yeah, I would defer to what Jenny says on that.
I will add a lot of the other programs I mentioned, like not the tax credits, but the grant and loan programs, a lot of those I think could be used for this. Specifically the resilience one, the environmental and climate justice grants from EPA that I was mentioning that's going to come out later this fall. That is specifically for decreasing the impacts of pollution on low income and disadvantaged communities. Those are the terms the statute uses, not my terms. But I think something like that, I could see the case if there's an incinerator that wouldn't be processing that waste. I think you can make the case for that kind of grant. I think the Greenhouse Gas Reduction Fund also could be used in theory for scope 3 under kind of a similar argument. So I think there are grants that could be used, but none of the tax credits specifically come to mind.
I have to say, I can't resist responding to Sarah's question in the chat around the USDA Cooperative Extension Agency service and whether we work with them at all. I will say that we haven't to this point, but the Extension Agency service was actually a big part of prior work that I did. When we used to, I was at the Institute for Healthcare Improvement at IHI and also had an organization of my own that worked on scaling up effective evidence-based practice. And we always pointed to Extension Agency as a great vehicle for spreading the best of what's known, and tried to emulate that in healthcare. I think an ideal would be, if we could start to harvest these best practices around resilience and sustainability and have the equivalent of an Extension Agency that where individuals could be traveling from site to site and area to area and sharing best practices, harvesting questions and challenges and innovations. That's a great model. We don't have the resources for that ourselves at this stage. You're sparking an idea for me that maybe we should talk about with the USDA about whether we can piggyback on that. But I'm wondering, Sarah, if you have specific ideas along those lines or opportunities you're thinking of that maybe we haven't.
It was actually just something that popped into my head because we met with Dr. Roger Runnekamp recently, and all of the things that he mentioned are things, that I think nurses would be really interested in. And, they're already in the communities and have great relationships with the communities. So, kind of taking advantage of those, already existing things and kind of plugging into those.
Yeah, I mean, my dream would be that, we kind of can create a core of environmental and climate clinicians and facilities experts around the country that are basically able to act as mentors and coaches and guides to others in their area. I think that's a model that we really ought to build. We've talked about that with the National Academy of Medicine Climate Collaborative, which we co-chair through Admiral Levine. but yeah, it's, I mean, you know, if someone is interested in piloting that on a local or regional level, you know, we'd be curious to hear how you approach it. I do think that that's a model that bears studying.
So I think you've kind of really addressed one of the questions, which is how can nurses kind of get involved in some of this work? But, you know, there was a comment in the chat, which I've heard before, which is really that it's about kind of selling some of these ideas to the hospital leadership and administrators. And I'm wondering if either of you have any words of wisdom around, you know, how to really leverage that voice of healthcare providers to kind of raise the priority of some of this work in the healthcare institutions.
You know, a lot of my thinking on this comes from my experience working on patient safety. So when I was at IHI, I worked on patient safety for a decade. I ran something there called the 100,000 Lives campaign, which was a large patient safety initiative. And the challenge there was, you know, how do we get C-suites and boards and organizations to understand the threats associated with patient safety and to prioritize this and to take action. And in a lot of ways, I think we're in a similar position here. There are meaningful differences too, but I think the lessons learned there and the lessons that I've been thinking about in the last, you know, 5, 6, 7 years as I've begun to work more on climate health, the ones that seem relevant are, you know, making sure that you're kind of armed with case examples and data that really speak to the challenges of the operational part of the organization. So, you know, I don't think it is always particularly productive to just make the moral case. We have to make the moral case. You know, the reason we're doing this is because of our you know, future generations, you know, and because of the well-being of those particularly vulnerable and exposed communities we're talking about, and because of our mission as healthcare providers, you know, so that is a part of the conversation. But for people who are running organizations, trying to stay afloat, keep people employed, do noble things, it is also helpful to provide information about the operational advantages and the efficiencies that can be gained by taking these actions. And so I think that we can help ourselves by making those cases. I think we can help ourselves by starting small, maybe finding a unit or a building or an area where we can demonstrate success and showing the efficiencies there and making the case in that way, making it a little safer for leadership to adopt a change. And then I think, you know, what we learned about boards in particular is there's really nothing to top peer-to-peer learning and peer-to-peer exchange. It's not that different than it is with clinicians, right? You know, a nurse is likelier to take the word of a nurse than they are, you know, someone who's not a nurse, and that's understandable. Equally, you know, these boards, if they can learn from other boards or study what other boards have done, that's very, very influential. If a COO can sit down with another group of COOs, or a building engineer can sit down at ASHE with other building engineers, you know, those are influential conversations. So trying to facilitate those exchanges is really powerful and really meaningful too. And I think, again, part of what we ought to be thinking about doing nationally is how do we create a set of those mentors, of those leaders and influencers who have those insights and experiences and have kind of seen the light or turned the corner, who can convey that to their peers.
Great, thank you. That's a great analogy to compare it to patient safety. That makes a lot of sense. Debbie has a question.
I wanted to find out, you've been talking about giving examples, and I think that's so important because for many of the organizations that work with low income groups, they're finding themselves these times low with vacant employees. You know, they only have so many staff. So I wanted to ask, in terms of putting in for these grants, how number one, it'd be great to have examples, because as you know, we're presenting it, or, you know, then they could say, wait a minute, we could do that. So even if you focus it on different groups, different groups who reach out. Maybe I'm from Florida, so there's huge needs here. But examples of what they themselves could do. And then can I ask about the process? I know you're saying it's important to be able to use or give the funding right away, but how long does the process take, and how complicated is it for these organizations that may have really limited resources to be able to apply?
Yeah, I mean, Debbie, you're going exactly to, for us, it's like a threefold challenge. It's how do we raise awareness about the opportunities? How do we help people scope projects? Like, what does an actual project look like? What am I talking about here if I'm talking about a solarization project? And then how do you help with the mechanics of applying or taking advantage of these tax credits? It's really, really, in some cases, intense and painstaking. The government is trying to simplify that, but I'll tell you, having been on both sides of it, it's not a straightforward process. And so I think that the answer there is that's our job. Our job is to figure out how we help people understand these processes and sort of break it into simple turnkey actions that people can take. It's particularly acute if we think of health centers or safety net hospitals where there is really very little room to do anything other than kind of just the immediate provision of care. So, I think that's where finding sort of prepackaged case examples that we can share is really important. Building confidence, showing, almost templates for taking action. Those are the types of things that I think we need to do. Jenny, I'm sure there's more you want to say, but there's it's a critical set of actions that we have to take.
The only thing I'll note is for every program that we know has been used by a health entity, there are examples in the Quick Finder. So like those 2 examples for REAP that I gave earlier in there. There are some like the direct payment where no one has used it yet because it's, it was just passed a year ago. And so there's not an example, but we do know facilities I can share informally that are planning to use it and are relying on it for their financing. So we can always kind of share those types of like sketch examples, but they won't probably go into the Quick Finder until they've been done in the real world.
Great, thank you. There's just really a comment in the chat with a link to a study or it looks like it might be a study about the percentage of healthcare dollars that are wasted on administrative costs. So I'll direct your attention to that. We're at 3:58. So there are no other questions in the chat. So I guess I would just, on behalf of Katie and Sarah and Daniel and Kara and Jessica from Annie. We have one more question, but I will just finish that thought just to say thank you again for coming. Millie.
Oh, thank you so much. I'm sorry for sliding in at the last possible second, but I'm very, very interested in what Joe mentioned about having someone from HHS come and speak to nursing organizations about the kind of what we spoke about today. And how can I go about arranging that or requesting that for one of my groups?
I think if you just contact us directly, it's OCCHE, OCCHE at hhs.gov. And make a request, we'll process that. So that's probably your straightest path. And, again, we're really focused on how we can help organizations take advantage of the IRA. So we'd be likely to be as responsive as we can with our tiny little office here. Perfect.
Appreciate it. Thank you.
Okay, well, we're right about 3:59, 4 o'clock. So again, thank you so much. This has been incredibly informative, has given us a lot to think about. And so thank you again for joining us.
Thank you for having me. Really appreciate it.
Have a great evening, everyone.
Thank you.
Stay safe, everybody who might be impacted